A very good morning to all of you. Welcome to my next series of nosodes. Today I am going to discuss Soranum, a very important polycrust medicine. Okay, so the source of this medicine. This nosode is first proved nosode by Henneman. So seropurulent matter of a scabious vesicle was used by Henneman. Then product of Sorasica. Actually it is some scaly brands were taken from their skin by Gross. Then again, Herring used a salt from a product of Sura, but their symptoms are almost same. Now, we'll discuss the constitution of this medicine. Sori constitution. Especially it is given to Sori constitution. What is Sori constitution? The Sori constitution is one which has only functional disturbances. They don't have any deep-seated or chronic deep-seated organic lesions. Okay, so they have functional disorders. That is Sori constitution. So very well indicated in Sori constitution where there is lack of reaction after severe diseases. So maybe after some diseases, if there is lack of reaction is when the immunity is very low. In that case, we can use Soranum. Now, these persons are generally very nervous. They startle very easily and scrofulous. Glandular affection is well marked. Then complaints are also of psoric origin. These patients they emit a very disagreeable odor. Very foul smelling patients. Even the children are very pale and they are sickly. They have a very sickly appearance. Problematic child, very troublesome, very irritable child, delicate and pale. Very peevish, unhealthy looking children. They also have a very disagreeable odor about them. Unbearable. Now let us come to the mental picture. Again, this patient is full of negative thoughts, very pessimistic patient, forsaken feeling, anxiety about health. So very much anxious about his health, about future, things about he is very hopeless, things that he is a loser. So very negative feelings are there in this patient, negative, full of negative thoughts. There is great depression. Especially there is fear of poverty and bankrupt. So, anxiety and they despair about the future. Okay. Again, the same thing. There is fear of poverty and bankrupt. Now, characteristic of this remedy. Number one, they are very chilly patients. Psoric patients are very chilly patients. Even in summer, they need warm clothing. They want warm clothing even in summer. They feel very bad or they are very restless before thunderstorm. So complaints are aggravated before thunderstorm, like phosphorus. Very sensitive to cold air or change of weather. These patients are very exhausted and very prostrated, especially after any acute disease or they have never been well since that acute disease. So when we have started nosodes, first episode I told you never been well since syndrome. So never been well since that acute disease, maybe after measles or any kind of malaria or typhoid, any kind of acute disease. So there is from loss of animal fluids but without any organic disease. Okay. Or maybe there is a loss of appetite or appetite will not return after any acute disease. And then also it can be used. Another remedy is China. After effects of infectious disease, lasting for years. Same thing. Never been well since syndrome. Never been well since that infectious disease. Lack of vital reactions, very low immunity. Or it is very well indicated when the case comes to standstill or there is no further improvement, or in chronic cases when well selected remedies fail to relieve. Okay. Again, one of the important characteristics of this remedy is foul discharges, whatever it may be. Stool, eruption, sweat, foot sweat, even leukorrhea, odor of body, everything is foul smelling, very bad smell. Now, appetite is very peculiar. They have a canine hunger. Usually, the psoriatic patients, they have a very good appetite. But in few medicines, we'll find there is canine hunger. Patient must have something to eat in the midnight, as we have seen in Sina and sulfur also. And headache, empty stomach headache, very important remedy for empty stomach headache or hungry before headache. They're very hungry. Okay, so Nux vomica is another remedy for empty stomach headache. Great desire, aversion, and thirst, like great desire for acids. And thirst is also well marked. Dryness of mouth is there. With that, there is great thirst. Desire for beer is well indicated. Desire for acids is well indicated. All nosodes, they have desire for alcohol in one or other form. Soranum is not an exception. Perspiration is, they have a profuse sweat after acute disease, but they feel better after perspiration. Yes. There is relief in all the sufferings, like natromure. Again, perspiration has a very bad smell. All the discharges have very foul smell. Even after bathing, there is foul smell. These patients are sleepless. The reason may be because of intolerable itching or because of some anxiety or 4-second feeling or some anxiety about future, all kind of things. There may be sleeplessness. These patients, they are very easily startled. They are very nervous, very anxious. Even in children, they are very good. They play all the day, but very troublesome, screaming all night. Just reverse of lycopodium, opposite to lyco. Now in clinicals, we can use it in headache. Headaches are usually followed by visual disturbances, and it can alternate with other troubles, like if there is suppressed menses, there can be headache. Okay, and this headache, a very peculiar headache is, peculiarity of this headache is the patient feels better while eating, like in a cardium and cardiopause, and the headache can be relieved when there is no epistaxis or nose bleeding, like mellitus. Another, now plica polonica. You can see that hairs are very dry, they are lusterless, they tangle easily, they glue together. Humid eruptions on scalp, suppurating eruptions, oozing sticky fluid like graphite is in Materia. Now, suppurating eruptions we find in hyperself also. Okay, many other remedies. So, oozing sticky fluid is very important characteristic of Meserium and graphitis. So, it can be used in crustalectia. Otorrhea, if after any chronic disease like measles or scarlatina, if there is otorrhea, and this is also very horrible fetid discharge. All the discharges of this remedy, and they have a very disagreeable odor, like decayed meat. Okay, next. in all kinds of acne, nodular, pustular, or cystic, or simplex. So, all forms of acne are covered by this remedy. Aggravation during menses, from coffee, fat, sugar, meat, or when best selected remedy fails or palliates. Now, very important remedy for quinsy. The tonsils are greatly swollen, painful, swallowing with pain in ears. Now, this remedy eradicates tendency to quinsy. I repeat, it eradicates tendency to quinsy. So, you can end the case with Sorainum also in such cases. The tough mucus in throat, these patients, they constantly hawk. They continuously hawk because there is some tough mucus in throat. Now, it's very important remedy for hay fever with change of weather. Aggravated in cold. Now, periodicity is very marked in Sorainum, appearing regularly every year the same day of the month, or every winter. History of suppressed eczema. So if there is history of suppressed eczema and there is hay fever which appears every year the same day of the month, we can think of Sorainum. Asthma. The peculiarity of this asthma is just opposite to arsenic. They are worse sitting up and better by lying down, keeping arms wide apart. Opposite of your arsenic. The cough is dry. Again, it returns every winter from suppressed eruption, or maybe asthma after suppressed eczema. Drinking causes cough. Then the remedy where the cough is relieved by drinking water, Cupromet. Lots of difference in both the remedies. Diarrhea. Diarrhea is sudden. Imperative like aloe and sulfur, but aloe and sulfur, they have morning diarrhea. Here the stools are dark, very bad smelling again. They smell like carrion. Very bad smell, involuntary, but they are aggravated at night, especially 1 to 4 a.m. Diarrhea after any acute disease. Now, constipation. Obstinate constipation with backache from inactivity of rectum when sulfur fails to relieve. So, there are patients and they'll tell you that there is constipation, and it's now very well known that constipation can cause backache. So, if there is obstinate constipation with backache and sulfur fails to relieve, we can use this remedy. Now, if there is immune resistance, bedwetting, and if you have tried many medicines like causticum, Sena, almost all remedies, and this you are not getting result, then you can think of Sorainum. These cases are obstinate cases with family history of eczema. If there is family history of any suppressed eruption or eczema, is the key note of this remedy. Pregnancy, most obstinate vomiting. The fetus then moves violently. Now, if the best selected remedies fail to relieve, to correct the soric dialysis of fetus, we can also give Sorainum. Wonderful remedy for skin. Skin, it covers all the diseases of the skin. Urticaria, eczema, acne, pustules, ulcers, scaly dry eruptions, everything it covers. So, intolerable itching, especially at night, or aggravated from warmth of bed also. Urticaria after exertion, herpetic eruptions on scalp and bend of joints. Generally, we find eruptions on bend of joints and tuberculinum. Yes. The skin is oily or greasy. It acts on sebaceous glands also, that's why. So it's a mixed kind of skin. It has a dryness as well as over secretions. Okay, so sometimes it's very dry, sometimes it's oily or mixed character. Pustules near fingernails, eczema, offensive discharge from eczema around ear, then the ulcers which are very slow to heal, then they have a dry scaly eruptions which disappear in summers and they return in winter. Again periodicity is well marked. They disappear in summer, they again return in winter. So modalities, like now you know that aggravation is from cold, change of weather, open air, washing, storm, then stormy weather, heat of bed, exertion, woolens. And amelioration by lying with head low, eating, nosebleed, profuse sweat and heat. Relations. Now, the complementary are tuberculinum and sulfur. Let me tell you that we should not use coffee because coffee is antidote of this remedy. Okay, so we should not give coffee to the patient. It is followed well by alumina, borax, and hepacel. It's endemical to legacies. Sulfur follows Soranum well in memory cancer. After arnica in traumatic affections of ovaries. It should never be given for Sora or soric diathesis but upon a strict individualization. Okay, so these are references. Thank you very much. Thanks a lot.